Thank you very much for joining our webinar. This is the last of our 4 webinars that we started in June when the second wave of the pandemic was raging. Thankfully, the second wave is over, but unfortunately, we have lost so many of our loved ones, and a lot of us are going through grief and bereavement. So we thought we'll focus on that topic today. I'll go into the presentation. So as you can see, this is about grief. See, we kind of chose this slide because people are being weighed heavily. People feel very just heavy. The sense of heaviness that people experience, it's mostly associated with our own thoughts. That's why this image, I think it fitted well with the times, so we thought we'll use that. Next, we are going to see a video of the American President Joe Biden talking about his own grief. He lost his wife and daughter when he was very young, and then he lost his son in 2015. I'll explain after you listen to the video why I chose that video.
When someone would come up and say, I understand, and then tell me, I lost my son, my daughter, my wife, etc., you realize they understand. When you've been through it, what people are really saying to me when they come up and ask me or want me to hug them or just, what they're really saying, tell me I'm going to be okay. Tell me I can get through it. How do you get through it? It's something that I can't say I enjoy doing, but I know what solace I got from people telling me you can make it, in effect, because they made it. And so that's why I do it. Back to the rope lines, people come up to me and say, I mean, literally, people will say, I don't know if you ever talked about it, they'll say, I lost my daughter 10 days ago. Would you just hug me? Men, just hug me. Let me know. Can I make it? And the extent that it gives any solace, I feel like I'm kind of paying back what people did for me.
See, I chose this video for 3 reasons. 1, to show that grief is real. 2, that it affects everyone. And the third point is that it can be overcome with the help of others and with time. And I want to kind of start with a bit of hope that in spite of the loss, people can still go back to the normal life, function, and sometimes use it as an inspiration to do well and better for others. So even though it's a very emotionally heavy topic, but I wanted to start it with some hope of some people who have who have overcome and have done well. So we are constantly seeing in the news about how people are being affected by the loss. There was even a recent report about how many children, I think more than around 1.5 lakh, 1.5 lakh children have been orphaned because of COVID. But thankfully, compared to 20 years ago, now people understand the emotional and mental health component of loss, and people are reporting it more. As it says, losing our family members, sometimes can feel like end of the world. It changes people's lives. It changes how people look at life itself, meaning, and it, people go through so many emotions. All those things, the process after that, it's what we generally call grief, and sometimes some people are able to recover within few weeks. For some people, it takes months, and for some, it goes on for years. And the one emotion that most people struggle with is a sense of guilt that somehow they could have done better, or somehow they have contributed to the loss. And it's a common thing that I hear from patients. So if you are not able to overcome this even after months, then probably you might need help. But I'll come to that later on, at what stage you need to seek help. But understand that this is a normal, natural process that happens to everyone. The sense of grief, the emotions itself is temporary, but the feeling of, the loss, of the person that has been, so close to you, and this lasts long. I'll talk about this in the two-stage, two-track model. And it becomes even more difficult if it's a person that has been, your mother or father, or your, the really close ones. What also we have noticed is that a lot of young people have lost their parents, and that has kind of forced them to, either leave study or take up jobs, or to look after their younger siblings. And this adds on to the complication of the normal grief process. So what happens, during grief? On a book called Death and Dying, the psychologist Elizabeth Kubler-Ross, she wrote about it. But this is mostly for people who had a terminal disease or who were given, bad news and who went through the disease process. This is not for the people who, survived after. So this is for the people who had the bad news. But over time, this has been extrapolated, and this is used as a model for any sort of loss, whether you lost a job or whether you failed an exam. There are certain limitations to it, but generally this model is accepted. So initially there is a sense of shock. Sometimes we are in a state of denial that we can't accept that somebody who has died is not there anymore. So we act and behave as if they are still around. Then people start to feel angry, and the anger could be directed at anybody. The anger could be directed at the person who died, saying that if only they sought help earlier. Or sometimes the anger can be directed at the treating doctor or the treating hospital. We see so many, acts of violence against health professionals. This has to be understood in a wider context, but sometimes it's done for criminal reasons, sometimes for financial reasons, but it's also part of the grief. So anger can be very damaging. Then the bargaining stage is for people who, sometimes people think that if only my child has survived, or if I had gone and the others had lived, it would have been better. So people sometimes go through that too. And then they get into a stage of depression, and finally reach a stage of acceptance. But sometimes, these feelings can prolong. I talk about prolonged grief disorder later on. But this had its limitations. People thought that, you can't have a universal emotional response that fits with everyone. So there's another model that's used. I'll talk a bit more about this one. In this, you can see your own experience. So grief happens in two tracks. One, it's what we are going through on a day-to-day basis, what happens to our emotions, what happens to our life. The second track is our ongoing relationship with the person who passed away. So sometimes what happens is, in the first track, people can experience anxiety, people can be depressed, people can feel bodily changes. It can affect their relationship with the friends, with the family. Their self-esteem could be affected, and they even question, they lose motivation for work, they become a bit more numb and all those things. While this is happening on one track, along with it, we have the second track where the memory of the person comes to us. We sometimes idealize our relationship with them. Sometimes we get angry about the relationship. And you have got both positive memory, negative memory of the person. So these two things sometimes go parallelly. Sometimes, in one track, you recover faster. And the other track, the second track, the relationship with the person, it's going to be ongoing for a long time. And how you adapt to the new life without the presence of that person is what is key. And that is mainly covered by the first track. So once your emotions are managed after a certain time, and you're physically, you feel stronger again, and you're able to go back to work and rebuild your relationships, or continue to maintain good relationship with your children, with your friends, with your family, and you go back to your day-to-day life, then that's great. But even when you're gone back to your day-to-day life, the second track runs parallelly. So once in a while, any memory, things that could trigger the memory of the person can trigger certain emotions, and you start to miss them a bit more, you yearn for them a little, and then again day-to-day life comes back. Few weeks later or few months later, another thing. So the second track, you have to give it time, and it evolves. And then at a later stage, we reach a stage where we celebrate the life they had, we celebrate the relationship, and sometimes we memorialize it, and all these things help. So this is also part of grief, and this people can identify more, because you can see that day-to-day life and all the things are on one track, and your thoughts and feelings towards the person who lost on another track. So these two models that I talked about, the two-track model and the Kubler-Ross stages of grief, this happens to everyone, during any loss. But COVID has complicated it. How has it complicated it? Because with COVID is one, it's an avoidable cause. So we, sometimes blame ourselves, that we should have, taken them to the hospital earlier, or we should have taken them to a different hospital, and all these emotions go on and on. If, for example, say you didn't have a chance to see them, because COVID is a very lonely disease. Once they go into hospital, you are not allowed to visit the COVID ward. So the person, you can't say your goodbyes in person, and you wonder, how much they might have suffered. It's all left your imagination. How lonely they might have felt, and all these things again it complicates the process. In normal times, you at least could have spent some time with them whilst they were in ICU or at home. The family and friends surround them, they come and say goodbye. So it helps to some extent to come to terms. But this COVID death is a very distant death. It's a very lonely death, and people's imagination sometimes can be worse than reality. So this is one way of COVID complicating the grief process. And then the other thing is, normally we'll have support systems that helps us to navigate these difficult times. Usually we have friends, family come and stay with us. People are helped with cremation or burial process, and there are a lot of rituals that people do. Sometimes they bathe, they do all those things. It slowly helps you come to terms with it, because if you are in denial or shock, this prepares you to slowly accept the death. And then, through rituals, we get some comfort that, the lost one is in a restful place, is at peace with themselves, or people who believe in God and, other belief systems, they feel they get comfort, through prayer, through doing each religion have their own rituals, so they do it, and that it helps them. But with COVID, people are not able to do it. One, it's very difficult for the others to come and attend because they themselves are worried about COVID, and there are government restrictions how many can attend. So people are have to go through this a bit more on their own, and they miss the support of people around. If you have listened to the American president's video, he would have talked about how he got support from others. If you watch the longer video, you will see that in the first loss, his wife and daughter died, but his two sons were alive. He was a senator at the time, so every night he would go back from Washington to Delaware, and he talked about how much his sons helped him through that time. I don't want to it might seem distant to us, but I hope it's relatable. So if you weren't able to do any of the rituals, what I would suggest is that now that the lockdown is over, you can visit more places. You can go to people who believe, they can go to temples, mosques, and churches, or the people who believe in nature. You can go to the places that the loved one really liked. If they liked forest or beach or mountains, you can go in their memory to such places, and it helps you to come to move on to the next stage. So prolonged grief, prolonged, that's it. I'll talk I'll explain it now itself. Prolonged grief disorder is a recognized condition. Okay, normally it can vary. The diagnostic criteria, it has to be more than 6 months since the loss, but sometimes it can happen. People can go through grief process even for a year or even 2 years. So what happens is, in prolonged grief, you maintain an intense yearning for the loved one for months and years after their loss. And it's still difficulty in coming to terms with it. And there is a sense of bitterness. There is a sense of numbness. You lose interest in life. You become very flat. So the people who see, can see the change in personality. You kind of don't have any motivation. So because of that, the productivity is affected. And sometimes, the rest of the family are around, but you can't engage with them in a meaningful way because the bitterness starts to have an impact on family and friends. That's why you would see, at least in the Western world, if parents lose a young child, a lot of them end up separating because of it's very difficult to maintain a relationship while you're still going through grief. And if there is a sense of isolation and alienation because you feel like the whole world is moving on with no difficulty, without any problem, but you are still struggling with it, and that can lead to a sense of alienation. Life can feel empty, and sometimes it can take on a larger process, in the sense people might want to be with the person who died and might start thinking about suicide because they want a reunion with them. So I talked about all the signs and symptoms of prolonged grief, but you only need to consider these things at least after 6 months of losing the person. So for the first 6 months, it's understandable. All these emotions, it's part of natural grief process. Sometimes, people may not have lost anybody because of COVID, but they might have lost a job. They miss meeting people. I don't know whether I think it was in the news, not sure yesterday or day before yesterday, a family in Andhra, I'm not sure, Andhra Pradesh or Telangana, have been locked in their own hut for 15 months. I think 15 months ago during the first wave, their neighbor died of COVID. So they became so anxious and frightened, they locked themselves. They didn't leave the house. So whatever they had, stocks, they just maintained it. And only recently, the government agency, for some purpose, when they knocked on the door, they refused to come out, and they had to get police help. And they were very malnourished. They're in hospital now. So the point is that it can have a huge impact and affects the sense of self. So I'll come to, because it's only 10 more minutes, I'll come to what we can do in these times. So the first thing is to help people understand that it is a process. It's not a 1 day, 2 day thing where people can move on, accept what has happened and move on. No, it's not an easy thing. And second point is about sometimes we want to comfort them, but we might say banal things, like thinking it's very philosophical, but just be sensitive to their emotional state. Okay, and you have to give them time. This third point, okay, is about how much do we want to support them or be with them? Yes, it's good to have people around, but sometimes people might want to be left on their own for a few minutes or for a short time to grieve. So we might need to give them some space, but at the time be aware that you don't want to leave them for too long for them to feel isolated or lonely, because sometimes they may be reluctant to seek help. Then the last point is about sharing your own personal experience of grief, if you have. If not, you can just be there. I remember one of my teachers talked about how idol worship has existed for centuries and thousands of years, because idols don't talk back to us, but people still go to them, pray, because sometimes just being there is enough. You don't have to do anything, you don't have to say anything. Just sitting there with them can be very calming and therapeutic. So if you don't know what to say, or if you don't know what to do, don't worry. Just be with them, and that's more than enough in most circumstances. So this is the last slide. So now people ask, so if you say that all these things are normal process or part of grief, feeling depressed, feeling anxious, all those things. So when do we need to seek help? So as I mentioned slightly earlier, if they are not able to adapt to the loss, and if they are not able to move on and with the day-to-day life, so that they are functioning back to their usual self. Yes, if you remember the 2-track model, yes, on one side they will still be missing that person. They'll still be yearning for them. There's thoughts and memories would come in between, like Father's Day, Mother's Day. Those type of things can trigger memories. You look at old photographs. That will happen at one track, but on the other track, you recover. You physically, you start to feel stronger. Emotionally, you start to feel more brighter, and you get preoccupied with day-to-day tasks, you get back to work, then your life moves on. So as long as that adaptation has happened, adapting to the new life without the loved one, then that's fine. But sometimes what happens is they are not able to, if you check with the 2-track model, in the first track, they're not able to move on. So they still feel down. They still, I'll repeat it, the ones that I mentioned earlier. There's a sense of numbness, there is bitterness, they feel very flat, dull, they're still in denial or difficulty in accepting the loss. There's a lot of anger. It leads to arguments with family members, with colleagues. Sometimes they are so depressed that they can't even go to work. If all these things exist, even after 6 months, then it's probably time to get some help. Sometimes you can wait. If they're on the recovery process, okay, you can wait for even 9 months or a year, as long as they are making improvement, month by month, getting back to their new life. If they're struggling, then that's a time to seek help. Then the second point is about depression. In depression, what happens is they feel consistently down. There is loss of energy, feel tired most of the time. Your appetite changes so that you don't feel hungry, or you feel hungry all the time and you seek comfort eating. Your sleep is affected. What's called anhedonia. You lose interest in things that you normally enjoy. So before, if you were watching, if you like sports or read books, listen to music, all those things that used to give you joy, now, they don't mean anything. You don't feel any joy out of it. Then if you have thoughts of like worthlessness, you feel that you're not good enough, your self-esteem is affected, you suddenly lost your confidence. Sometimes, a sense of hopelessness gets in and you think this is it, there's no chance to get out of it. And people start to have suicidal thoughts, suicidal acts. Then that's another point where people need to seek help. There are many other reasons, but these are the two common things following a bereavement, that if it persists, please seek help. Okay. This is the last slide. I'll take questions from now on. Okay. Okay. I would like you to focus on the trauma of children who have lost both their parents, and what can we do about it? Yes, this is now, I think even World Health Organization has stepped in because there are so many children have been orphaned. I think what can we do about it? It depends, what role you're playing with children. If you're a family member, how close you are, or if you're a friend of the family, or if you're a professional like a teacher or other. So your role is important. It's the first thing, as I keep repeating, is it's a process that it takes time. And with young children, without knowing the age of children, I'll give you both scenarios. With very young children, their vocabulary isn't developed to to verbalize their feelings. So sometimes they might act out. So if they are, sometimes angry, or if they are, very naughty or very difficult to handle, that could be them acting out their emotions. So we need to be, we need to recognize it and respond to it rather than react to their behavior. So that's for very young children. So with those children, what you can do is, it's like art therapy. You give them, things to draw. Slowly their emotions, start to, come in paper as drawings. Or you can read, books of children who had lost and ask them to talk about emotions and slowly increase their emotional literacy. And, give them time. At older children, like more teenage children, they are able to, talk about it, and there'll be a lot of anxiety. So they might need a lot more reassurance that things are going to be, not okay, but that they'll be looked after. that's very important, giving comfort and confidence that they will be cared for can reduce a lot of their anxiety, and then they will miss them so much that they can get angry towards other siblings or people who haven't lost. There can be an emotion of envy at others who have everything good, whereas they seem to suffer more. So a lot of emotions young children go through, and they might start to think bad about themselves because they're having these negative thoughts. So spend time with them, help them to verbalize their emotions. What I mean is help them to talk about their emotions rather than show it through behavior. And even if they show it through behavior, be considerate and help them to put it in words. So slowly, by talking, and you would have probably heard the phrase, a sorrow shared is a sorrow halved. And be there. Sometimes, as I said, just being there is enough. Second question: how to overcome effects of COVID lockdowns, having COVID infection in siblings, the hospitalization, losing my job, dependency on others for basic needs, landed me in depression. I can pull myself out, but again the depression comes back. What to do? How to manage? I think what you're going through is normal. I mean, the difference between depression and the normal adaptation to such a loss is that in depression, these feelings remain consistent on a daily basis for more than 2 weeks. Okay, if you're having such intensity on a daily basis, then you would need to seek professional help. Whereas if it happens once in a while, but in between you're able to cope and you're able to function, you're able to do your things, then it's okay. So the way to kind of losing job, again, so many people have lost job. It's about either finding, thankfully the lockdown is over and the economy is getting back on track, so more people are able to find jobs now. If the line of work you were in wasn't very lucrative, or it doesn't have a big future, then you might need to reskill yourself, learn something different, something new that is in demand. That way you can make sure that your finances, if not immediately, but within the next 3 to 6 months, you should be able to find a job. Till you get that, it's okay to accept help from others, how much of a difficult it might be for us. Sometimes people feel bad about getting help from others or asking help from others. Your friends and family wouldn't mind. They would be more than happy to help you rather than see you suffer on your own. Third question: sir, I lost my parents same day to COVID. I can't digest and come out from this grief. Yes, I'm really sorry to hear that, because it's very hard. It hits you like it's difficult for somebody who haven't experienced this grief. I'm talking about because I lost my father 6 months ago, so I know. And I think losing both of them on the same day is it's different. But what I would go back to is, if you remember the American president's video, with time it does get better. How it gets better is, it's not like one day you suddenly wake up and everything is better. No, that's not the case. So say, for example, if you feel perfectly okay, you give a score of 10. If you're really feeling down at the bottom, you give a score of 0. If you monitor on a daily basis, what you would find is, like, as weeks progress, slowly from 1 to 3, you will get a lot more days where your feeling is about a level of 5 or 6. Okay, and then maybe like 3 months down the line or 4 months down the line, you might get a day where you felt 8 or 9. And so the more as time goes by, you will start to have more and more good days and less bad days. On the bad days, make sure that you have people around you and you're not on your own. That's very important. But as I said, give it time, get support. With time, you will be able to get out of the grief. Sir, I lost my husband. He's only 33. I have two baby. One is 5 years, another is 8 months. My God, I accept his death. Why happened to me? How I take my child without a father? Again, I'm really sorry, especially with two young children. Being a single parent. Um, you mentioned that you accept his death. But it is difficult. The question of why it happens to me. It's a question that everyone asks. People say, no, I have done no harm to anybody. I've never wished harm to other people. I've led a good life. Why me? And philosopher has tried. Religious people have their different answers. Nature scientists have the different answers. It's a random thing. But all these intellectual, scientific, philosophical things are of no comfort. It can be helpful once you're out of it, but when you're going through grief, these emotions are real, and nobody can give an answer for why happened to you. But don't blame yourself for it. That's the only point I would say. Because when you lose, you have two children who need your help and support. And one way of honoring your husband is to raise them well, so that he'll be happy wherever he is. Again, get help from your family. Don't be think that you have to manage it on your own. With two young children, even a young couple would struggle. It's almost impossible as a one person to excuse me. Question about how I take my child without her father. Again, you can read of people who have gone through these difficulties, and in this new world, you might meet somebody who you really like, who you understand. The person understands you, so you don't have to live on your own with the two children. If you find the right person, you can marry and live with them. It doesn't mean that you're. Sometimes people feel that they're betraying their, first wife or husband. That's not the case. If you think about it, your husband or wife would want you to be happy and want, the children to be happy. So they would like to see you more happier than suffer. So don't think that you may not find anybody new. So it's too early to talk about it, but I just want to kind of mention it. How can I manage my anger on my parents for my husband's loss, and how to overcome the fear of the other loss? If you understand, it's your anger is part of grief. I don't know the exact circumstances of your husband's loss. So, are you angry at your parents because they found you this person, or whether they excuse me, intervened in the treatment process? I'm not sure, or whether it's just that you are angry and they are the only ones who are near you, and you can only take it out on them. If that's the case, it's okay. Your parents would probably be able to understand. If they're struggling, you can see a psychologist or a family therapist. Again, what I would say is, put your emotions into words. Even if you're angry, you can tell that you're feeling angry about things, rather than show it through behavior. I am a 33 years old woman who started my own business against all odds 3 years back. So much of criticism. Managing my two children and my company was not easy. But my business was turning to show profit. But when COVID came, I couldn't meet all my ends. I tried as much as I can to save my business, but I had to close it down last year. The thought that I failed and all the people mocking me now, I feel lost and depressed. And, the first thing is, congrats on you for, starting your own business, because that's not an easy task. And you are able to turn it profitable with so much struggle. So, don't discount it. You have done it once before. And with times changing, you will be able to do it again. So that's the first thing. Sometimes, other people mocking, people mock, other people, for them, it's immaterial. And if we start to worry about what others say about us or what others, talk behind our back, we won't be able to do much in anybody, in our life. So that's part and parcel of, trying to do something. Whenever you try to do something, there will be people to criticize. So it's okay. What I would suggest is you can read, books of, other business people who have overcome. Okay, I'll suggest, you go and read about, the Honda. We have the Honda cars and motorbike. If you read about it's his name, the person's name itself is Honda. If you read about how he set up his own factory, how it got burnt, and then the World War, so many losses, so many things had gone wrong, and he kept coming back again and again and again and again. So perseverance. I'm sure you can do it again. If you've done it once before, you will be able to do it again. If you're having self-doubts, if you're having depression symptoms, then seek help. You will be able to get back. I'll leave the name. I'm 21 years old. I was the topper of my school in 12th, but I took up journalism in college. It was my passion and I wanted to follow it. I looked forward to all the fun at college, traveling many places, learning, investigating cases, etc. But my college experience was just 1 year. After that, COVID lockdown and no more college. It has really shattered my dreams, and the fact that I will not be successful in my life is tormenting me. Okay, I can separate the question into 2-3 aspects. One is about missing college and missing all the fun associated with college, and then the second is about why you feel that your dreams are shattered and that you will not be successful. See, missing college is very understandable. The camaraderie and all the experience that you see in, but what it is like, as you get into professional life, you will be again involved with other people who will become your friends, with whom you would hang out, with whom you would participate in activities, which may not be the same, but it will be very similar to what you missed in college. So that experience you can always, at some level, you will get back. But when you talk about, this has led to, shattered dreams and that you will not be successful. That's a huge jump that you have made. It's based on your thought error. If you use a cognitive behavior therapy model, you have generalized one aspect into your whole life. Just missing college, doesn't mean that you can't get a job. It doesn't mean that you can't go and investigate cases, and that doesn't mean that you can't be successful. All that has happened is you just missed 2 years of college. That's all. You persevere, you keep at it, and I think I'm wondering whether you might be going through some depression, because you're talking in very extreme negative language. That's more than what one would feel in their missed college. Sir, I lost my mother a year back. I'm unable to come out from the loss. I feel like the entire world is empty without my mom. Undergoing a depression. How should I come to normal? Yes, if it is, no. Mother is very close, and it's probably one of the most powerful bonds that exists in the world. Relationship between mother and child. And in your case, it's been more than a year. If you're still struggling to get back to work, I don't know your age, but if you're struggling to get back to your work, get back to your family life, able to look after and provide, then probably you would need to seek help. Whereas if you're able to do those things, but you still miss your mom, then that's very natural. So that's the thing you need to focus on. You need to focus on whether you're able to function. If you're functioning, it's okay. What you're experiencing is very normal. With time, you can start celebrating your mom's life. Whatever your mom was interested in, whatever she adored, whatever she enjoyed, you can do things around it. And when the anniversaries come, yes, there is a sense of sadness, there is loss, but at the same time, in her memory, you can do a lot of good things. Whatever she wishes, you can donate to an orphanage or feed the elderly or the disadvantaged, in her memory. So slowly that will help you come to terms and celebrate her. Sir, it's been a week. I had lost my beloved brother due to post-COVID complication. He left a 4-year-old boy and a 4-month pregnant wife. Please help me how to console my parent and my sister-in-law. Oh, that's, again, so many tragedies in the last few months, with almost, everybody needs to prioritize, what's important. I think you yourself will be going through the loss. So I can understand, the struggle that you have. At the same time, you're going through, you also want to, for your parents, it's a huge loss. And for his wife, especially with her having a small child and being pregnant, where the new child won't even be able to see the father. It's hard, but I think the way you can't be, just be there for them, help them to talk through in time, whatever your brother, liked, he adored, what's in his memory, what would he like, what was the thing that he loved, probably it's too soon, it's only, a week, you're still being acute grief. So for the time being, just be there for them. And if they need comfort, just put an arm around. And if they need reassurance, provide reassurance. You can't say something to make it better. You can't, this is such a thing. So just be there. That's more than what you can do now. I lost my 2 friends, my brother-in-law, auntie, and all this made so pessimistic. Every time I feel so scared. There are 2 things to it. One is about feeling pessimistic, and then the second is about feeling angry. Feeling scary, which is about being anxious that you might get COVID. What would happen if I get COVID? So that anxiety is on one side, and as I said, in grief, part of grief is when the people who were just with us yesterday, now they are no more, and suddenly life can feel meaningless. Life can feel pointless. What's all this about? This has led to so many self-exploration. So what I would suggest is, you focus on the people around you and what they would need. If you go back to American president, the reason I'm using the same example is so that people can understand. For him, he talks about how the 2 sons that were left behind following the accident, how he had to do things for them, look after them, and that kept him going. So when you lose so many other people in your life, you still need to think about the people who are in your life and who still cherish and need you. But also the people who you lost, they also want you to do well in life, be happy, and all those things. Okay. So next question is, I was a carrier of the virus and gave the infection to my mom. She could not make it, but I did. The guilt of killing my mom is draining me emotionally. How to get over it? Oh, it's probably one of the hardest feeling that one can experience is, I think I can see how you phrased your question, the guilt of killing my mom. The reality is you did not kill your mom. Okay, the disease killed your mom. But when we are going through grief, when we are going through the stage, as guilt is part of the grief process, and we feel personally responsible for their death. But in this case, no, you definitely did not kill your mom. It's the COVID virus, and that killed your mom. You were a carrier of the virus, and you don't know you was the person who gave the infection to your mom. She could have got it from somebody else, but again, we make our mind makes a lot of assumptions that makes as if as you put you killed your mom. It's all of them are assumptions. These are not fact based. So talk to the people around you. Yes, it is very draining emotionally. How to get over it is, again, talk to people, give it time. There is no quick fix. A lot of your assumptions, that can be easily be challenged with, you can talk to the people who are involved in your mom's care. Almost 2 years have passed with COVID tormenting my life. I have heard a lot of death news, anything and everything negative. It has impacted me so much that even if I sneeze, I think I have COVID and I'm going to die. Even with my parents, I'm maintaining social distancing. Even if this isolation is killing me, the fear that I may die, I don't know, I feel so paranoid. Yes, I understand it. You remember the one that I answered about, the family in Andhra who have isolated themselves for 15 months, locked the door, didn't open, didn't leave. The anxiety around COVID is very real, and with you, it's understandable to some extent, okay? But at the same time, what you're suggesting seems to be more than the ordinary anxiety, because if you're isolating yourself, you're not going to get COVID. You can only get COVID if you're in the presence of somebody who has COVID and who's talking to you and their droplets has entered your mouth or nose. So, get facts-based scientific information that should reassure you on how COVID is going to spread. The other thing is get vaccinated, because with vaccines, the hospitalization and death rate is very, very low. Vaccinate, again, wear mask, maintain social distance. It's okay, you can maintain social distancing with your parents, that's understandable. You are right to feel paranoid to some extent, but you still need to function. So I'll finish with this message today. The second wave is over. The third wave, it depends on a lot of factors. It might happen very soon or it might happen a bit later. So please vaccinate yourself, get both the doses. It's very effective. The data from all over the world shows it's very, very effective. Continue to wear masks in public places. Maintain social distancing, because the only way you're going to get it is when other people with COVID, and they speak, the droplet infects you. So please maintain all the safety measures. This is the last of the webinar. We might do something later on, but I wish everyone the very best, and please remain safe and look after your loved ones as much as you can, and look after yourself. Thank you.